Thanks everyone for joining us again for another edition of the Chapters Health System Q&A. We've got Lieutenant Colonel Jennifer Durbin joining us once again of the Florida Air National Guard. She is down in South Florida, in Miami. And Jennifer, the last time we spoke, you had seen 0 patients that day in the convention center down there, but we know numbers have risen and things have changed. So what are things looking like now where you are?
So, hey, Pat, it's great to hear from you. Great to see you again. So we're actually still in a holding pattern right now, but things are starting to heat up down here in Miami, not just patient-wise, but I got to tell you, temperature-wise, we're on a 6-day record-breaking heat wave going on down here. So it's hot down here in Miami for a lot of different reasons. So we still have not opened up or turned on the inside hospital here at the convention center, but we are still working the outside mobile testing. So we are one site here in Miami Beach, and we actually do more tests than any other because we can do the walk up, we do drive up, and we also do antibody testing. So we're running upwards of over 1,000 tests a day here with our testing here on site.
If you can, why don't you take me through a typical day for you down there? What does it look like?
Little activity going on here in the background. So I'm going to take you through maybe a typical day of what we do. So we usually arrive on site sometime around 7:15, 7:30 in the morning. By the time we get here, we've already got cars lined up ready for testing. So that they start lining up between 4:30, 5 o'clock in the morning. Sometimes based on the volume, they may wait upwards of 4 to 5 hours to get through testing just because of the sheer volume showing up for this free testing at our site. So they enter our gates up front, they go through a screening station. We ask just a few questions to try to determine why they are testing or why they're coming for testing. A lot of it is work related. So we test a lot of the local city officials, the fire department, the police department, beach patrol. We see them on a regular basis through our lanes out here. So a lot of people come. We have people that are coming that are symptomatic, people that come for requirement for work, and people that are going to travel. So they need testing for some of that. We had a lady come through. She was trying to get a flight out of the country, and she needed to have testing before she could get back in. So the clients show up. They come through our screening. From that point, we determine what testing they need. We send them down one of the lanes. You can see one of the lanes briefly behind me. This is our COVID testing lane. So they'll come through. We'll gather their information, process them in the computer, and then I'll spin around here really slowly, and we'll send them on to the next station, which down there behind me is going to be the collection site. So there's basically 3 stops once they get in. It's going to be a screening, it's going to be a scribing, and then a collecting station. After that, they're on their way.
How much busier have things gotten in the last, say 3 to 4 weeks?
Oh, Pat, I can't even tell you. So we used to have little lulls through the day. We would have patterns or periods of time with no cars, but it has heated up so much down here that it's nonstop. Once that gate opens, we are rocking hard all day long. So cars are here all day, and we have to close the gates at the end of the day, and there's still people we haven't been able to get to test. So it is very busy down here.
Now, as you're speaking to us now, I see you're in your fatigues, but I imagine you're wearing a much different attire when you're actually over there performing the tests.
No, sir. This is my attire for whatever function I'm working on the testing line. So the only absence is that depending on which side I'm at, I'll have full PPE on. So as we connected, I took off my my N95 mask and my goggles so that you'd be able to hear and see me better. But I'll put those back on to go on the line. And then when I run the collecting station, I'm gowns, gloves, the whole shebang. So add that to the heat index, and it's a good time, I got to tell you.
Yeah, I know. You and I were at one point making disposable wipes, and we were collecting donations of masks and gowns. And luckily, we've been doing very well with our supplies here in the Bay Area. We've had a lot of generous donations of supplies and cash, and hopefully, you have no shortage of PPE down there with you.
No, actually, we are doing very well with our PPE. We are all fit tested for whatever mask we have on hand. If our supply changes, we get refit tested for what we have. So we do wear our N95s for a day and then rotate them out based on what our supply is. But gowns, gloves, face shields, goggles, we're doing pretty good. We've got what we need to take care of what we're doing down here. So we're very blessed for that.
Good. Are you showing your colleagues how to make their own sanitary wipes?
if the need arises, we will absolutely do that. So right now we're doing pretty good on that supply as well. So we do have a wipe down process at the end of the day to clean all of our equipment, clean our computers, clean everything before it goes back in the bins to get set up again for the next day. So it's a 7-day a week operation down here. So we start the lanes at 9 o'clock. We get in here, like I said, about 7:15, 7:30, and then we go till 5 o'clock, but sometimes we're here till 6:30 to clear the lanes and get the traffic through. So we're on a 1 day a week off day, but other than that, we're here at the site doing what we need to do to serve this population down here. So.
Wow. Well, we're certainly very proud of you, Jennifer. I know last time we spoke, we were maybe talking about when you were coming home. I'm sure that's unfortunately been pushed back, but you are doing very valuable, very necessary work, and you're making everybody here at Chapters very proud. So thank you.
Thank you. I'm so proud to be part of Chapters and be able to represent and serve down here in this community. So, there's little whispers about the hospital possibly opening. We did open, but there was a facility that's going to open tomorrow that's going to receive basically long-term care patients, assisted living patients. So they'll be housed there. There's 250 beds there, and that'll be specifically long-term care and assisted living. And then there are little rumors going on about this hospital we set up. So we'll just kind of have to wait and see what happens with that. So we'll see where the mission takes us. It's a day-by-day operation. So.
All right. Well, hey, I appreciate you taking a few minutes here. Appreciate everything you do, and glad you're staying safe. Jennifer, thank you so much as always, and look forward to catching up with you soon.
Hey, thanks, Pat. Thanks, everybody at Chapters, and thanks for everybody that supports Chapters. We really appreciate everything, and I appreciate all you guys do and continuing the mission back there on the home front.
All right. Thanks, Jennifer.